thanks very much, Chris. It's a great pleasure to be here in Prince Charles and also to be here to launch these DVDs. When I was on the way up in the car thinking about how to approach what I was going to say, I was reminded of the fact that it's not that long ago when patients really didn't get much information. They didn't ask either. My great-grandfather went into Swansea Hospital, as it was then, opposite Joe's Ice Cream Parlour in Swansea. That's where the building was. Not that I remember it, but it was there then. For an operation for some kind of cancer. 1936, before the war. He died 6 weeks later. And my grandmother, his daughter, only died 2 months ago. And between 1936 and 2013, she had no idea what he died of. All she knew was that it was some kind of cancer. And when I said, oh, why didn't you ask? She said, there was no place. And the doctors didn't tell us. All they said was, there'd be no pain. It's difficult to imagine that people actually didn't feel they could ask anyway, and really it wasn't their place to ask. We know that the more information people have, the less frightened they are. People are still frightened. If people are suspected of having cancer, they're going to be frightened. It's natural for that to happen. But I think the more information people have in terms of what's going to happen to them, what they can expect as well, that sometimes you have an operation, you can expect to be unwell for a little time afterwards, and that's quite normal. But also, of course, that they can get some reassurance. We know, of course, that there are many patients now who are having operations that years ago just leave them in hospital for weeks, or now in 48, 72 hours sometimes. And being able to give people that reassurance is, I think, marvellous for them and helps in the post-operative process. If people have an idea of what's coming, I think it prepares them better for their recovery. And so these DVDs are, if you like, the culmination of a process from 1936 to 2013. And the way things have changed to a situation now where we take the patients need to know as much as they can about what's going to happen to them, and that gives them a level of reassurance that otherwise they wouldn't have. It's always a frightening time when somebody's diagnosed with an illness. People are still frightened of cancer. We know there have been great advances in many types of cancer over the years, but people are still afraid of it. The more information they have, then the better it is. So I want to congratulate the team here for all the work that you've done in terms of producing these DVDs. I know they build on DVDs that were produced some years ago as well, but you recognise, of course, as people who treat patients day in, day out, week in, week out, that reassurance is an important part of medicine. Yes, you know, the surgery is important in terms of the recovery of the body, but that level of reassurance and that provision of information is important for the whole recovery of somebody in terms of mind and body. So it's a great pleasure to be here today. Great to see Chris Chapman here as well, as I have the kind of values looking around and seeing any other AM. I haven't missed out because I know there was more. I get to mention it, everybody. And it really is a landmark today in terms of making sure that when people come to hospital, they know what's in front of them, and in doing that, it helps them towards making a quicker and fuller recovery. So thank you very much indeed for asking me to launch the DVDs today, and I look very much forward to watching them with you in the next few minutes. Thank you.